Hi, welcome to another edition of eCW Podcasts. I'm your host, Brian Saal, and today we're speaking with Alyssa Pearson from the South Lake Pediatric Group in West Minneapolis, Minnesota. Hi, Alyssa. How are you doing today?
Hi, I'm good. How are you guys?
Doing great. We're doing great. Wanted to talk to you a little bit about what originally drew you into using the healow products that you're currently using. I should point out that you have some amazing numbers around this. I think we looked at 98 or 99% of your patients were set up on Messenger, and about
Yep.
81% are using the portal. That's phenomenally great. So
Yeah.
what was it that got you initially excited about using Helo?
A lot of it was we would do monthly outreach for patients, kind of asking them what they wanted from us as a clinic. So that has really made a huge difference is listening to what our patients, our parents are telling us. And a lot of that was being able to use a patient portal like they can at an adult-based clinic and book appointments online, see messages from our clinician, or send a message to a triage nurse right when they're thinking about something, regardless of what time of day it is. So 2:30 in the morning, 10 o'clock at night, whenever they think about something, or their kid gets a fever or has sick eye, they can schedule now or go online and send a message to us through the Helo app.
Are you currently using Helo Kids, the Helo
Yeah.
Kids app? What do you think of
Yep.
that?
Our parents love it. Just anything from being able to see the ins and outs, ups and downs on the app, being able to track the breastfeeding or the diapers, even just something like that helps us talking to our triage nurses. Moms love it because if they can't come to an appointment, they can put notes in for what they want the dads to ask. And they know it'll get asked because he's got the app on his phone that he can pull out and reference those questions right then and there. So it helps eliminate the number of phone calls back we have after appointments saying, oh, we forgot to ask about this specific question, or anything like that. And they love the feature of being able to send in a message to a triage nurse. And then our triage nurses also have the option back on that Helo app, and the Helo Kids app, to be able to send them a summary of what was discussed in the care advice on there. And then they can reference that app at the same time for the medicine dosage or all of that.
Yeah, I know I've talked to several parents who really also were very happy that they could see their own growth charts on the
Yeah.
app, and
Yep.
and as well as developmental milestones.
Right.
So those, from a parent's point of view, myself, I wish that was around when my kids were little. So going back to those numbers that you had that we talked about a little bit earlier, how would you? What sort of advice do you think you might give another practice about how to at least bump their numbers up if they're not doing that well with attracting clients or patients, I should say, into using Helo? I know that you worked somewhat with some folks from our marketing department to come up with
Yep.
some marketing materials. Can you kind of describe that process for other potential providers?
Yeah. So we did the biggest thing that we did that I think helped with our success is we did an all staff training. So that is anywhere from our administration team, our medical assistants, our PAS department, which is our billing. Everybody went through a training. We did about eight to 10 individual training so that we could make sure we reached everybody. During that training, everybody received a packet of information. So it laid out what was available in both the Helo and the Helo Kids app so that they knew what the difference was.
Mm-hmm.
We created test patients, so both under 2 to kind of show some of those growth chart pieces where it reported back what our clinic had put in, and then as well as what parents could put in from home to kind of track and know the difference between the scales was a huge piece for us. And then we made actual little photo flip books. So we just took screenshots on our phones of the different portions of the app, and each of our reception desks have those there so that when they're talking to a new parent, if they're questioning it when they come in, they can actually get that part out and show them some of the features that are on it. And so that includes being able to pull up quick for them to know what field trip form or showing the timeline, the milestones, being able to put different things in the journals, and all of that. So we were able to do a lot of that with training, and then we did it in conjunction with your marketing team, created a little bit more personalized flyers to South Lake Pediatrics, and it was able to put both the healow and the healow kids information on each side, and it really truly show them that, you know, all of this information and the features are available right at your fingertips 24/7.
Just as an aside, on the new patient portal, version 8, parents will be able to download the entire immunization record so that they don't have to come into the office to have it signed, etc. They'll also be able to download school forms and sports forms as well directly off the portal, saving everybody a whole lot of time. So that's a great feature that's coming down the pike, or is actually in production for users of version 11 now.
Right.
One of the other things in talking about the healow app that I always get kind of excited about is the TeleVisit. Are you using the TeleVisit application at all?
We're not currently. It's something that we've started to look at. We're very interested in some of the other area clinics that are starting to pilot that for, especially like EDC visits.
Mm-hmm.
So definitely an interest of ours.
Now let's kind of shift gears here and talk about what the benefits are for the clinics. How are they utilizing healow, and what's working out for them?
Sure. So we actually, one of the biggest opportunities we found was being able to work with our after-hours triage service. So when our patients call our main finance line and they get forwarded to our triage clinic, they actually will direct patients to the website or to the healow app to be able to schedule appointments when it's recommended for the next day. So when we're not available, our triage service directs them and shows them how to do it. We've opened it up to kind of a broad open access. You don't have to be a patient here. You don't have to be web enabled. Anybody can go on and be able to see what appointment times we have. It gives peace of mind, you know, and instant gratification for those families, especially when, you know, you don't plan on your kids getting sick. And it really made a huge difference for us during our morning phone rush, especially during cold and flu season. If there are some Mondays after the weekend where we'll have over 800 phone calls, and having the availability of going online and booking those appointments right away has made a huge difference, both with the clinic satisfaction and patients too.
So you are using healow open access?
We are, yes. Yep. So we put the blocks on, healow blocks, and we're advertising those. So we have blocks on every single clinician, all 6 sites, all throughout the day for parents to be able to see ahead of time.
So they can actually book their own appointments. It's not going through a front office person to approve it. They are actually going out. That's fantastic.
Yeah.
The parents must love that. Yeah.
They do have the option of sending a request if they don't see something that they like, but the number of requests that we have are pretty limited sometimes, difference of how many they book by themselves.
Again, going back to tips and tricks for other practices who might want to be expanding their use of healow, is there any one thing that your practice has done that you feel really got patients or parents interested in doing this? I'll give you an example. You said that you had trained everyone, and that's a great step forward. That's fantastic. I had interviewed a group out in Carson City, Nevada, where once a week, everybody in the office had to wear a bright green T-shirt that said, "Ask me about the patient portal" or "Ask me about healow." Did you do anything like that along those lines?
We didn't. We had it kind of balloons. Everybody talked about it at the Go Live piece. Probably one of the bigger things for us is that with the flyers that we created with the marketing piece, we have in our hospital rounding folders. So when our clinicians go to the hospital for new babies, and then we have new patients or prenatal appointments where they come to see us ahead of time. They all walk away with a folder from us with various information, and right in the front of that is always our flyer. that shows what all the benefits are. And I think that is a huge selling point for us as a clinic.
Well, that's fantastic. You're getting them at a prenatal stage. That's I don't want to say jumping the gun, but you're right in there, you know. So that's fantastic. I'm sure that a lot of time went in before you actually rolled this out to test it and to make sure that it was meeting the standards and giving the correct information, of course. Can you tell us a little bit about your testing procedures?
Yeah, so we built in, this was kind of before it was actually linked within eCW, so we went into P2P, built every single clinician profile, and then it linked their primary service locations or wherever they see patients at. We had 6 primary clinics. And then we did testing initially just with our numerous test patients that we have to make sure we knew what kind of messages they were getting back, both for direct booking and sending appointment requests. And so we did a lot of testing, and through that time frame too, with just having it open, we actually had quite a few patients that would find it just on our website or the healow.com piece, and actually be able to put information or appointment requests through. And so that kind of worked to just get their feedback right away too. What do you like? What do you want to see? All those different things. So not only did we do testing with just test patients and fake appointments, but we actually were able to get some live patients in there also.
Oh, that's great. I'm sure that during the testing process, you and your folks got to know the apps pretty well. Yep. What about patient adoption in terms of the learning curve for the parents? Did you find that they needed a lot of hand-holding, or the product was intuitive enough that they could jump in with both feet almost immediately?
Honestly, it was pretty easy for them to jump in. The biggest pieces were just questions on where they could find specific information and letting them know, okay, it is different than the patient portal now, where you log onto the patient portal, you have to have your individual login. So we're really looking forward to that with version 11 changing. But that, on the app, you can have all of your kids under one account, and then being able to have the staff show them how to add each of their patients was huge, and so or each of their children. So being able to take care of that from off the bat, I think everybody else was able to figure their own way through the app very easily.
You must be pretty excited as well about the proxy portal coming available with.
That's something huge for us for pediatrics.
Yeah, that's something that peds practices I know have been asking for a very long time, and I'm glad we're able to give it to them. What do you see as the future for healow within your office?
The big piece for us is just that effective communication, being able to communicate with parents how they want to. You're not bound by a phone call. They can see the message from us on their Apple Watch or wherever they get those, and being able to communicate back with us when it's most convenient for them. So that's probably the biggest thing that we're looking forward to, is seeing how that evolves and what more can come from that. We're very excited to be able to put, sports forms and all of those things online too, so that helps decrease the number of phone calls, or even the parents calling and asking for something and us calling back and leaving a message and all of that. So we're really excited to see how much more our communication and all of that can be streamlined.
Alyssa, thank you so much for being with us today. We really appreciate your time and your insight into the healow product.
Thank you.
If you're interested in more eCW podcasts, you can find them at myecw.com or on iTunes or YouTube. Thanks for joining us again, and have a great day.